All right. So, good evening and afternoon and good morning, anywhere you're listening from. My name is Elsa Kepi, and this is the Pleasure for Health podcast. And we are very excited today to have a guest speaker, Dr. Elliot Justin, who is the CEO and founder of FirmTech. He's going to tell us all about what he's been up to. It sounds pretty interesting. Um, I think I'm just gonna let you introduce yourself, whereabouts in the world you are, and give us a little background on how you ended up having your own company.
Sure. Well, my, my mission at FirmTech is better sex and better sexual health to everyone. How are we achieving that? Through smart wearables. We're providing people with data that will allow them to hack their sexual health and ideally so that everyone can enjoy a long lifetime of lovemaking.
All right, so we're gonna have to break that down because my
Okay?
listeners are gonna be like, "What the heck is a wearable?" And they're gonna be like, probably all of the things you said, they're gonna be just kind of going right over their head. So let's break it down a little bit and maybe tell us like what the heck is a wearable?
Well, wearables are things that we put on our body in order to get information. Well, they also be things we put on our body in order to get pleasure. But I kind of break the world of sex tech down to two areas. There are toys, and then there are devices that are going to give you health information. So people are familiar with smartwatches, smart rings, Aura, Whoop, Garmin, Apple Watch, and those are all wearables. And then there are smart bands to monitor your heart. There are devices you can put in your skin to measure your blood sugar. So those are wearables. So we actually live in this incredible 21st century of healthcare wearables to give us vi information about our vital signs, but there's a gap, and that gap is sex. And that's the gap that we fill. It's actually kind of extraordinary that given how interested people are in sex and how important it is to their health and their happiness, that this area is has been overlooked. How did I get into it? My background, I'm an emergency medicine physician, and in the past, and I think I probably took care of about 180,000 people in the course of my career. And I am aware as a man, as a doctor, that there are few emergencies that concern a man short of a heart attack or a stroke as much as a consistently limp penis. So we help men, figure out what's going on. 4 years ago, I was challenged by a urology professor at the University of Utah to come up with a way of counting the number of nocturnal erections that men have. And I basically said, what the heck for? And he said, because they're a leading indicator of a man's cardiovascular and sexual health. And that kind of took me aback. One, I was unaware of the significance that we all know about morning wood and we laugh about it, but we don't, and frankly, a lot of doctors think that asking someone about if they have morning wood tells them about their sexual health or their vascular health, and it doesn't. One is not enough. So this doctor showed me some articles indicating that, a healthy man has 3 to 5 nocturnal erections per night. I call it the night shift. I think, your penis is trying to talk to you at night, and you're not listening because you're asleep when there's no night nurse checking up on your vital signs. The so when he told me that it's a leading indicator, I said, well, that means it's predictive. And he said, that's right. And the number of nocturnal erections that a man has come down by 50%. He has a close to 50% chance of having a cardiovascular problem in the next 2 or 3 years, angina, heart attack. So that kind of took
Tell
me
me,
aback.
tell me a
Sure,
little bit about the physiology of that. So,
sure,
we all know blood flow increases to the genitals, that increases arousal, pleasure, the erection possibility for men, well, and for women. Um,
women have nocturnal
how
erections
is
too.
that predictive of cardiovascular health? A little more in depth. I'm
Sure.
quite curious about that.
Well, the thesis is that small vessels are more sensitive to decrease in blood flow than large vessels. So, when your small vessels get plugged, the heart doesn't. You don't get a heart attack. But when your small vessels get plugged in your eyes or penis, where the blood vessels are very, very small, and easy to see their effects, uh, change the curve. So um, it's not easy to get a retinogram, but it's pretty easy now with our technology to find out about the blood flow into your penis. So the heart's a pump. And the arteries that go from the heart to the penis, and the arteries, those arteries are narrowing because of hypertension, diabetes, atherosclerosis, or the pump is not pumping effectively, often both in combination. But the penis doesn't get enough blood, and erectile dysfunction can result. But
Mm.
we've documented over 200,000 erections, and the good news for the vast majority of men is heart failure and arterial insufficiency, lack of blood going to the arteries, is not the leading cause of erectile dysfunction. As a matter of fact, most of the men who've been labeled as having erectile dysfunction don't actually have dysfunction.
Yeah, well,
It's
I
a,
mean, I've seen that too in my practice that it's not normally physical. It's a lot of other aspects to erectile dysfunction.
yeah, well, it's probably the primary problem is probably on the other side of the circulation, on the venous side of the circulation. Uh, so basically, the expectation of urologists was as the incidence of erectile dysfunction goes up 10% per decade after age 50, I'm 73, my age, 70%, that the number of nocturnal erections would go down, the firm's nocturnal erections would go down, and the firm's sex erections would go down because there'd be less, because men are getting older, they're getting more hypertension, more diabetes, more cardiac insufficiency. And that's only happening to 12 to 30% of men. The vast majority of men are staying just as hard up until late 60s, and there's a little bit of tapering as men in their 30s. And I don't think that lack of confidence is the primary issue. I think that lack of confidence plays in with the fact that, I'll put it this way, the if the International Society for Sexual Medicine defines erectile dysfunction the following way. It's basically two main clauses. First clause, difficulty achieving or inability to achieve an erection. And if men have that problem, they need to see a doctor. They have more than likely not have a significant cardiovascular, metabolic, or urological problem. But the vast second clause says difficulty maintaining erection. Well, that's physiological. That's a totally different group. And whether that difficulty maintaining erection is due to uh, performance anxiety, baby crying in the next room, taking medications that we doctors insensitively prescribe to people that affect their sexual health, like antidepressants, SR antidepressants, or certain antihypertensive medications. If a man's getting an erection, the primary goal of therapy should be to keep blood in, and only an erection ring will do that. If you told me 4 years ago, Alyssa, that, hey, Elliot, you're going to be speaking about erection rings for the rest of your life, I would have said, like most straight doctors, what do you mean? I'm good. I don't need that. But the data, our data specifically, is showing that a ring should actually be the primary therapy. The PD5 medications, the erection pills, blue pill, the yellow pill, they put more blood in, and that's nice. But this not doesn't affect the primary problem, which is keeping blood in.
So the ring that you put on, the wearable, is measuring blood flow and also keeping the blood in the penis. Is
Yeah,
that
I was expecting that, because um, I got into this with the data. This urology professor challenged me. We have counted the number of nocturnal erections, and my thought then was, well, how are we going to do that? We need to let's embed sensors into an erection ring. We'll popularly call it the cock ring, but let's call it an erection ring because I don't. Cock ring puts in the realm of a sex toy novelty as opposed to what it's actually doing, which is both assessing erections and supporting them. So these cock rings have never really caught on because they're made out of hard silicone. They pinch, they're uncomfortable, and they're not particularly safe to wear for prolonged use. So in order to count the number of nocturnal erections, my thought was you have to change the material and change and make them safer. And the inspiration actually came from my wife. So this urologist challenged me to come up with this technology. And I said, I saw on my wife's desk that she had a stress ball. And I said, gee, why don't we make an erection ring out of a soft elastomer rather than hard silicone? Because silicone as a material makes you adapt to it. Elastomers adapt to you. So, our devices are soft, they're stretchy. They allow the arterial blood to flow in because one counts nocturnal erections overnight, and they only constrain the venous return. And the harder the erection, the more the constraint. So I was scratching my wife's back. Yeah, you know, I would say probably, I would guess, I can't back this up scientifically, but I would say probably half the heterosexual sex in the world in a committed relationship starts when a guy is scratching his wife or girlfriend's back when she takes off a bra at night. And why is that? Because the bra is irritating to the skin. There's a silicone band in the back, pulls on the skin. And you want to get scratched. Women adjust their bras frequently during the day for similar reasons. And I never really thought about the fact that I probably adjust the underwear band on my underwear 2 or 3 times a day, also for the same reason, because it's irritating to the skin. So I was scratching her back, and I looked down on the ground, at her bra, and saw this. A bra opens and closes with a hook. Women do not put on bras over their head. Well, maybe a sports bra, but they don't put on bras over their head. They open and close with a hook. And I thought, why not, for safety and for ease of use, why don't we make an erection ring that opens and closes with a hook? And that's how we came up with the material and the safety feature. And we've documented over 200,000 erections on 4,000 men. And with the non-tech rings, I know we sold 24,000 of them, and they've probably been used for sex well over 1 million times. And to my amazement, Alyssa, zero complications. I certainly would have thought by now I would have had some guy send me, some picture of a yeast infection, at least a yeast infection. Uh, and not even that. I mean, once in a while, a guy will send me a picture of irritated hair follicles because he manscapes and they have sex with it, with a ring on. But so there, I would, I'm very pleased and by the safety of the device. So, but the device itself counts the number of nocturnal erections, measures their duration and firmness. And we've had 4 men that we're aware of get cardiac catheterizations because they got the ring, and the ring showed them that one guy had 0 nocturnal erections, the other two, three guys had 1, and one guy had 2 weak ones. And that alerted them to the fact they had a cardiovascular problem. I will add that 3 of those 4 rings were bought for them by their wives, and 2 divorces resulted because the men were blaming their sexual problems on their wives when the real problem was a cardiovascular problem. And we've also had 2 very young men, one guy 24, one guy 28. One guy had an adrenal tumor, and the ring triggered him to the fact that he needed a better workup for it. His doctors were blowing off his problem as being it's in your head, it's in your head, it's in your head, you're young. But he actually had significant adrenal problem. And the other guy was a bodybuilder who was really overdoing it on anabolic steroids. And his fiance bought him a ring, had me look at his data. He had like 1+ nocturnal erections. They were weak in strength. And I got the history from him that he was lying to his fiance about his anabolic steroids, and he went off and got the problem reversed.
So you're saying that this device will point out when you have heart problems better than just going to the doctor for your checkups kind of deal?
I think it should be part of the standard of care. I mean, one of my goals with this device is for this to become part of the standard of care. I mean, look, I'm 73. If I went off to my doctor for a checkup, I expect electrocardiogram, expect MIH, maybe CT calcium score, blood tests, etc. It would be extremely beneficial if that standard workup, included an assessment of my cardiovascular health because once someone's nocturnal erections reflect that, but also my sexual health. We doctors do people disservice. We don't ask about people's sexual health at all. And I mean, I'm the only time I've had my sexual health be queried is when I went to a urologist because I wanted testosterone and I wanted the government to pay for it. My wife has never had a doctor ask her about her sexual health unless she really asked the question. The United States, and you're in Canada. I bet in Epic, I don't know what EHR you're using, but in Epic, the biggest electronic health record in the United States, there are no questions about sexual health. And when people talk about this subject, they'll like come to this make this sort of gross assumption. Well, we're just inhibited as a culture about sex, and that's obviously not true. We're not inhibited relatively. No, we're certainly least less inhibited than Southeast Asia or India or the Persian Gulf. I believe the fault is with us as doctors, and the fault and we spend very little time with people. I mean, studies in the United States indicate the average urologist spends 7 minutes actually talking, having a dialogue with the patient, and a family doctor around 10 minutes. And you and I both know if there were a box, I'm talking about the United States now, if there were a box in the electronic health record that said, make it up, anyone over 45, you have to ask these questions. Do you struggle to get an erection, or do you get an erection and lose it? doctors would ask that question if they were prompted to, especially if they could also collect money, ask that question. Because we ask about vomit, diarrhea, uh, you know, you know, pus. We ask people about all sorts of disgusting things. So to say we're too inhibited to talk about sex, I just don't believe it.
Hmm. So, have you ever had someone not want to know, like they were like worried they're gonna find out that they have a heart problem? They're like,
Well,
no, don't.
yeah.
I'd rather not know.
Well, the people who buy our technology are that are looking for they're technology oriented. They're looking for answers, and many of the people who we know from customer surveys who buy technology, unfortunately, don't trust their doctors. So,
Hmm.
for example, I talked about the guys who got cardiac catheterizations. We've had three men report to us that it was recommended to them that they get a penile implant, and they had nocturnal erections. They need their problem was in their with psychogenic probably, and not physiologic. And I have doctors who are utilizing the technology. I mean, doctors utilizing the technology. There are few urologists in the United States using it on pretty much on everyone, and they report similar. They're kind of taken aback and pleased by how it is bringing objective data and personal data to their practices. Because one of the mistakes we doctors make repeatedly in medicine is we treat everyone as just a one size fits all. So
Hmm.
I'll pick on you and me. I'm looking at you with different ages, different body habitus, different genders, probably might take different medications. But if we went to a doctor told the doctor, hey, when I go to the gym, my face turns red, my chest pounds, and then my pulse is irregular. I think I have high blood pressure and a heart arrhythmia. And the doctor told us, well, let's see, Elliot, that's really interesting. Take these two pills and come back in 6 months. We would think, what the heck is going on? They're going to check my blood pressure, get an electrocardiogram, get a cardiac echo, how about some blood tests? But that's how we treat erectile dysfunction around the world. We pass out pills, and we don't even know what the right dose is, and that's
Hmm.
wrong. And and let's look at high blood pressure alone. You and I, United States, they would put us both on the same pill, same dose, and tell us come back in 3 months or whatever. What they should tell us is get a blood pressure cuff, take your blood pressure twice a day. Let's have a telehealth visit in 2 weeks and go over your data and see if this is the right pill or the right dose because they're all different. And the fascinating thing with our technology is it allows uh, the assessment of cardiovascular health through the penis, but also of sexual health through the penis to become personalized and objective. Because I know from, I'll just talk, I have men who respond to 5 of Cialis, tadalafil, and others respond to 10. I know for myself that taking 20 is no more beneficial than 10, but I wouldn't know that without the data. Similarly, if I'm doing testosterone replacement therapy, um, one of the parameters I want to follow is a man's sexual erections and his nocturnal erections. But the dose that at least that gets a positive response is variable. Men in my same age group who weigh the same as I do might respond differently to different doses. So I think what we're doing is going to become the standard of care.
Hmm. Yeah, it's interesting because my practice is much more based on the non-medicinal, non-prescriptive drug type of therapy. So it's interesting to get the other side of it where, oh, okay, well, there's data that could be useful with with cardiac health, with what's
Sure.
going on.
Well, if you're treating a couple for for sexual issues, and the man actually has a medical problem, you're doing them a disservice, to my mind. So there's now data, and there are sexologists who are in the United States who are utilizing who are as I hate the phrase, who are getting out of their lane into the medical lane and saying, wait a second, I'm taking care of a guy who's 55, who's taking 3 different medications. Maybe there's something else, going on with this person. The doctors are doing disservice to people all the time, though, because they don't even ask the questions. At least people in therapy are asking questions.
Hmm.
The doctors just pass out pills, it's like, hey, pill's not working, it's in your head, and
Hmm.
that's wrong. That's wrong.
Yeah, I think it's definitely there's room for both aspects and definitely want medical doctors referring to, people like us that are working in the realm of not always needing to have an erection to have good sex either. So, there's a
Sure.
whole band around all of that. But I do think that it's helpful to know there's data collection out there. The question's going to come though. You mentioned we were different genders. So what would you say to women coming and listening to this? And
Yeah. Well, here it is. We're coming out this year with the world's first monitor, health of the clitoris. So we're going to be, I mean, we already tested a prototype 2 years ago using essentially like it's the same type of sensor that's in a pulse oximeter, like the thing you put in your finger, the oxygen content. And we published a paper about it. It was the problem with that technology was that we could yeah, the clitoris is the visible clitoris is mobile. And so we got motion artifact. It was a lab tool and not an at-home monitor. And my goal is to provide people with at-home monitors. And by the way, Alyssa, I recognize a good deal of relationship between people is subjective. It's not objective. I'm just on the objective side
Mhm.
of this particular of this part of healthcare. Um, but now we have come up with a new form, and we're going after the bulbs, the clitoris. So for people who are listening and don't know what the bulbs are, the penis and the clitoris are in many respects homologous organs. They emerge from the same embryological tissue. And I could say it jokingly or ironically, but I could say it seriously too, that the penis is just a prolapsed clitoris. Or a big clitoris. And because there are some extraordinary similarities between the two of them. So there are these two tubes for your listeners. I'm certainly aware of this, but two tubes in the penis called the corpus cavernosa, and they fill up with blood. They what goes from takes a man from soft to hard. Uh, in the woman, it actually is not so much the glands of the clitoris; it's the bulbs of the clitoris, which are which are analogous to the corpus cavernosa. And the bulbs of the clitoris are the size of I can't think of an analogy like two walnuts, but with a couple like a large walnut, and they're on both sides, and they're behind the labia minora, and they're invisible. Well, they're not, no, not, they're not external like the glands of the clitoris, and they fill up with blood. So
Mhm.
it's all about sexual pleasure, sexual health for women is all about vascular engorgement, just the way to a large degree it is with men. Now, to your point earlier, yeah, guys can have some pleasure with soft erections, and women who have diseases can still experience pleasure. But I want to talk about what's normal, what's happening. So we're going to, as we measure the engorgement of the bulbs, the clitoris, we can now assess the impact of diabetes, hypertension, atherosclerosis, birth control hormones, SSRI antidepressants, antihypertensive medications upon a woman's sexual health. And that's going to be really valuable for gynecologists and for people like you, because you'll be able to objectively see what's going on if there's a significant problem.
Mm. So do you find that women have a similar pattern nocturnally then with
That's a
her
great question.
erection?
Yeah. So no one studied it. No one's actually studied it since Masters and Johnson.
Mm.
And they were waking up women like every hour in a lab setting. And then they were measuring blood flow uh, by kind of subjectively grading the change in tissue from pale to red. And then they had calipers that they were measuring the size of the glands of the clitoris. No one's actually done this before. Uh, and that's, we're really excited about it for obvious reasons, because we are going to push and pull gynecology and sexology for women into the 21st century of objective, data-driven care.
Mm. Well, it sounds like you're well on the way to getting this new device as well. So when is that due to come out?
We have the form factor now figured out, because with the challenge with the male device, it was relatively easy to, the male device anchored on the balls and wraps around the shaft of the penis. So it's very, very easy to avoid motion artifact with the sensors. With the female device, the challenge was we needed something because we want something to be worn during sex as well too. And sure, we'll add a vibrator eventually, but we wanted something that be worn during sex. So it had to be something that would not come out overnight,
Right.
and also would stay in even during vigorous sex. Uh, that took 28 variants before we finally got to something that we think will work in 95% of women. There are always going to be some outliers on either side who will, where they're going to be problems. But our goal as of the male devices, we want to cover 95% of people. There are always going to be people too small, too large, but and we also want a device that would be comfortable and also pleasure enhancing, like the male device. The male device keeps men harder. Um, Female device now, at least in the two women have used it during sex, one who's my wife, it also functions as a sex toy, which is fun.
Hmm. And can both partners, if it's a heterosexual couple, wear
We're
them at the
the
same time, or is it one or
we're
the
the
other?
only pioneers. So we have worn both, and it's I'll say it worked. Actually, it addressed a sexual problem that people don't want to talk about, men and women, which is um, as men get older, uh, sensitivity decreases for a whole variety of reasons. But one of those reasons is uh, penetrative sex uh, gets less friction. And my wife is 71 years old, so we had reached a point where, frankly, I would avoid certain positions because I knew that I would lose my erection in those positions. I wasn't getting friction. So the penis gets friction from two sides. The side facing the body that gets friction from the pubic bone, and then the side away from the body is getting friction from the vagina. And as the vagina ages, especially if women have had multiple children, they don't that friction is no longer there. Now, from talking to lots of men, this is more your world because I really didn't understand this issue. I hadn't thought about this. I thought about it personally, but I hadn't thought about a solution till I got involved in this. But a common complaint that men have is, and they I'll be graphic. They get aroused with their wife, their partner, or perhaps a gay guy too, but they go down on their partner because in a healthy marriage, in general, the woman comes first, and then uh, their partner wants them to penetrate them, but now they're no longer hard or they're half hard, and they're not getting enough friction in the position in whatever that preferred position is of the woman. But they don't want to complain about the position, and they don't want to complain about the lack of friction. They just can't be. No one wants to tell their partner, "Hey, you're too loose." It's kind of a buzzkill. So they don't. The ring helps because the ring will keep them hard and put more blood into the penis. That's part of the benefit for men. But this device inside the vagina now decreases, if you will, the negative space, provides a friction point. So it was designed to provide friction for the head of the penis right there. And in my experience, that's a game changer because it addresses the friction problem. And actually, the female side of the company, which we call my FirmTech, plans they're going to market this just as a standalone, without the sensors, uh, as an aid for not I wouldn't want an aid as an optimizer for pleasure for men and women.
Hmm. Well, it sounds like an interesting um, development. Uh, I wonder too if there's, as with I find I'm also a massage therapist, and when people use braces and things for, sore wrist or whatever, it's helpful, but it also takes away from the actual strengthening or working of the tissue itself. And I'm wondering if you think there's any downside to using these wearables, as in taking away the actual like learning to use those muscles internally, learning, to
Well,
strengthen your
let's
pelvic
let's let,
floor.
let's talk about it practically. I want to draw an analogy. So I'm 73 years old. I don't run as fast as I used to run when I was 25 years old. Do I have running dysfunction? We throw this word dysfunction around, and it's not really it's just a problem for most men. So what muscles are we talking about? Well, one of the major muscles that are involved in men and women's arousal and climax are smooth muscles. You can't work out smooth muscles in the gym. You have to work out smooth muscles by using them. And so now let's talk about the skeletal muscles that are involved. So because we should be advocating more frequent sex for the smooth muscle use, but in terms of the skeletal muscles that we can control, um, the pubococcygeus muscles. I'll talk about in women first. I'll talk about in men. So the pubic muscles in men are involved in um, they are a little bit of an aid in ejaculation, um, but that's about all that they're involved in. And if the man is having sex regularly, he's working those muscles. There was a there was a physical therapist in the United States. She had a chain of pelvic of clinics really focused on pelvic floor strengthening, largely in men. And there are many men who need that. There are men who have had they got bladder problems. They've had prostate surgery, or they've had prostate radiation, or they benefit from pelvic floor exercises. But there's a common notion that pelvic floor exercises are beneficial to erectile dysfunction, and I don't think it's true. And I don't think it's true because of the study that this woman did. I'm not going to give her name. I have an NDA with her, but she wanted to see what was actually going on objectively, to see whether, gee, if men are doing pelvic floor exercises, are they getting more? Are their nocturnal erections lasting longer, and are they firmer? And there was no change. So I don't want to take away from the benefit of pelvic floor exercise in men who need it. Hey, you're obese. You've had prostate problems. You've had bladder surgery. They need it. Now in women, uh, the pelvic floor exercises, how much can they actually tighten, the vagina, so to speak? I don't think that most women, unfortunately, have the discipline to comply with the Kegel program. The women who do, and their partners report to me that it's great. But I don't think them. I don't. Also, most women tell me, "Hey, I'm not gonna, I'm not gonna do it." So we're also talking about um, muscles that are closer to the surface. But during penetrative sex, the penis is going deeper than that. So there's the oh, so I don't want to take away from it. I think it's beneficial, but in terms of increasing in terms of increasing male pleasure, possibly female pleasure, sure. I think that, but does it actually increase the power of contractions for a woman who does pelvic exercises versus not? Hey, that would be a great study. And if you want to do that study, I'm happy to work with you on that one because, God, what to have actual proof that pelvic exercises in women produce a more intense orgasm for them, as measured by um,
Mm.
as measured, for example, by our device, as measured by showing increased blood flow, but also with this device, which goes inside, obviously like that, we're going to we have a pressure sensor there, and the pressure sensor can also measure PCG contractions. So we'll soon be able to uh,
Yeah, that would be
prove it.
interesting research for sure.
Be a lot of business for you.
Well, I definitely think that it's helpful to have all different, things to throw at someone if they are having, as you said, trouble with sex or trouble with their heart health or wellness in general, of which sexual health is definitely part of it. It's helpful to have a number of, you know, um, pathways to help them for sure. So I think people will be happy to hear that there's some other options out there as well.
Yeah, and just before you mentioned that part of your therapy is helping men who have significant erectile problems, except realize that you can have softer erections and still have orgasms even.
Oh,
Um,
absolutely.
yeah,
Yeah,
but
absolutely.
it's from talking to lots of men now, who don't who do get fully hard. Uh, it's we have this mistake that sort of penetrative sex is the be all and end all for them. And for having spoken to a lot of men now, and I think this can be quantified. The majority of men over the age of 45 or 50 would actually rather have a climax with their partner's hand or mouth. And why is that? Well, there's a brain attached to this and attached to a mouth. You know, the hand is just an incredible tool that can provide friction, whole varying friction and varying stimulation. And they are reluctant to discuss that, some of these men, with their partners because there's
Mm,
just sort of this expectation that sex, to your point, oh, well, sex is about penetration. Well, even for the men who can't have difficulty penetrating, what you're doing is really powerful. But it'd be great if we just put out. That's why I'm having this conversation with Frank. You just put out there that even though I got into this for the data that would tell people about their cardiovascular and sexual health. But it's also involved a lot of conversations with men and sometimes their partners about what's really going on. And
yeah, that sounds like one of the best things about this whole thing is just it's like you said, doctors are potentially can ask a patient, what's going on and can have some data to look at and they can feel like they might have something to suggest. So that sounds like a win-win in my book for sure.
Yeah. Yeah. And there are, oh, I thought I turned my damn phone off. I apologize once. Apologize for that. The yeah, I'm hoping that one of the things that will come out of what we're doing is not just people getting the vital signs of but one of their most vital organs, but also ha this becoming the data becoming open up the conversation you just said, open the
Mhm.
conversation between the doctor and the patient, but also between the man and soon the woman and their partner.
Yeah, that sounds good. Well, I know another question my listeners might have at this point is, I know you're in the States and I'm in Canada. What are your shipping possibilities?
We ship to Canada. Unfortunately, the tariffs are an issue for some people. But you can find us at myfirmtech.com. We are applying to get into Amazon Canada,
Okay.
which will make things easier. It just takes time. We'll get there. We're in Amazon in the United States. We'll get to Amazon Canada. Uh, I don't want to reveal their names, but there are some Canadian doctors in Vancouver, Edmonton, Toronto, Montreal, who have their staff drive across the border
Okay.
to get rings. It just That's the nature of the relationship between our two countries. Even before Trump, it just there. I mean, people crossing the border both ways take advantage, to avoid,
Right, right.
payments.
So,
Not
and are you
not that you
shipping
and I would ever,
worldwide
not that you
at
and I
this?
would ever advocate that cheating, right? I would never. No, no, I
No,
never.
okay.
Yeah,
Do you find that you're shipping worldwide now as
we ship
well?
worldwide. We have distributors in Australia, Japan, Korea,
Well,
Poland, Romania, um, Germany, Spain, Portugal, Brazil. So yeah, the UK
oh,
and not
right.
Canada. It's really frustrating. We'd like to ship to Canada, but we
Okay,
have to.
so remind us again where people can find out more about your products.
Sure. MyFirmTech, MyFirmTech, myfirmtech.com.
myfirmtech.com. So I will put that in the notes as well of the podcast. And well, it's been fascinating learning all about how wearables can really, give you data, give you information about your overall wellness, about your cardiovascular wellness, about, and bring up this great conversation about sexual health and how to have more pleasure, which of course is something I'm passionate about. So I have to give you a big thank you for taking time to come chat. And is there anything final thing you want to share?
Sure. Men should put a ring on it. Put a ring on to
Put a
the
ring
vital
on it.
get the vital signs of sexual health, but also put a ring on because it's going to enhance your performance. Rings, you should be thinking about rings, something that are for gays or guys who have a fetish. A ring will enhance every man's performance.
So don't be shy. Get a
Exactly.
wearable. All
Yes.
right. That's a great last line. Well, thank you so much, Dr. Elliot, and we will look forward to hearing how if you get this the female version out there, we'll have to have you back on talking about that.
Excellent. Look forward to it. Thanks so much.
All right, thank you.